Good morning, everybody. After the insightful dialogue held yesterday by our esteemed speakers, we are looking forward to launch the second day of the third Sharjah Regional Clinic Cervical Cancer Forum. Today, we will cover a new theme covering the topic of communication, advocacy, social mobilization. Okay, let me go through a little bit the agenda. The theme will be presented by Dr. Iman Tawheed from Kuwait, by Dr. Fatima Al-Hamlan from Saudi Arabia, Ms. Radhika Shrivastava from India, and Ms. Fathiya Salama from Qatar. Just a reminder that the webinar, the forum is CME accredited by the Dubai Health Authority with 9 CME hours. Dear attendees, please fill up the evaluation form at the end of the forum to get your certificate of attendance by email. Without further ado, we would like to start our first session for today by introducing Dr. Iman Al-Tawheed. Dr. Iman, she's a consultant gynecology at Kuwait Cancer Center. She's a general secretary at Kuwait Oncology Association, and she has excessive experience working in multiple hospitals such as in Ireland, UK, Saudi Arabia, and Kuwait. Dr. Iman is the Kuwait representative of the Society of Laparoscopic and Robotic Surgeons and the European Surgical Academy. Dr. Iman will talk about advocacy and partnerships, mobilizing for effective cervical cancer prevention. Dr. Iman, welcome, and the floor is yours.
Okay, thank you very much. First, let me thank the organizing committee for getting involved in this important forum. And I'm going to speak to you today about the advocacy and partnership for effective cervical cancer prevention. So I'm going to speak to you today about what's the advocacy, how would you define it, and why do we advocate, and who can advocate, and how to advocate in terms of cancer cervix. So first, what's the advocacy? By definition, it's shedding light on a particular cause with the goal of influencing people or organizations. Now, why do we advocate for cervical cancer? Because the cervical cancer is the main cancer in female, secondary to breast cancer, and it constitutes one of the main NCD diseases, of course. And WHO in 2018 issued special call for action to overcome this NCDs, which is the MENA group is at particular risk of these diseases. Now, in 17th of November 2020, the WHO has committed to eliminate the strategy to eliminate the cancer cervix, and they shared vision with countries to eliminate it by 2030. So you have to reach or maintain an incidence of cancer cervix in your area below 4 per 100,000 women. Obviously, in this strategy, they identified the 3 key pillars and their corresponding 90-70-90 in terms of vaccinations, screening, and treatment target to accelerate the effort. Now, obviously, we know that the general public, they're not fully aware of this particular disease for many reasons. I'll come to it shortly. And despite this cancer, cervix has preventable and treatment very well recognized all over the world now. First, who can advocate for this cancer cervix prevention? Basically, anyone can advocate for this prevention and control. And you can either make your advocacy your full-time career, or you incorporate it into your existing career, like what I do right now. Now, the most successful advocacy campaign involves diverse range of, you have to involve individuals, groups, and organizations coming together. But the best one for me, from my limited experience, I guess the patient who are really impacted by it and their families, of course. Now, I will start with the policy making field, because we here I'm speaking particularly in Kuwait, the policy makers, of course, they have their agenda is full, and maybe they don't have enough time to concentrate on particular issue. But by what I'm doing now is by campaigning and try to attract their attention for this devastating disease. Obviously, doctors are fully aware and involved, and the nurses. Now we're starting to involve the media and, of course, some patients, especially if they are doctors. They are affected by this disease. They are the best who can advocate for this prevention of this disease. Now, I give you two examples of existing campaign, advocacy campaign on international level. There is a group under the wing of European Society of Gynecology, the initiative of European Network of Gynecology Cancer Advocacy Group. They launch every year 20th of September, a day of awareness regarding the cervical cancer. Now, at GCC level, we're starting the same. Now, every year, the Gulf Federation of Cancer Societies, they held every year a campaign for awareness, obviously including health staff and employee at Ministry of Health, in order to address the prevention of, in general, cancer. But this year, of course, we're having next week, first week of February, the Kuwait Oncology Association with all associations all over the GCC. We have the Cancer Awareness Week starting from the 1st to 7th of February. And I take the chance in this week to speak about cancer cervix in particular. Now, how would you assess your current advocacy framework? Now, first, you have to ask yourself, does your country have a cancer cervix prevention and control strategy? Now, if you have it, good, you're doing a good job. So first, you have to identify which section of your policy is missing or not implemented or not working properly. Now, if you don't have it, like in Kuwait, for example, we don't have like sort of well-organized strategy. So I need to advocate for this strategy. Now, then after that, first you have to evaluate what's the size of the problem. Like in Kuwait, the Cancer Service Institute always, since we started the cancer registry in the last 20 years, always the incidence is less than 4 per 100,000. But now the problem is that the projection rate. Now we are expecting, according to WHO figures, they are expecting by 2040, the figures will be 40%. 40% of the figures will be affected. The patient will have cancer cervix, obviously because of many changes culturally, environmental, and socioeconomic. So this is why I'm highlighting on cancer cervix, because the projection rate is frightening, despite presence of screening and prevention and vaccination all over the world. But still in Kuwait, we are still in the road. Now, so we have to, obviously you have to put your time frame. How long would you take to evaluate your strategy plan, awareness plan or advocacy plan, and what's your vision about it? You will get, what's the level of your public support? What's the level of your decision maker support? It's medium, low, whatever, and who you identify, who are your partners, and obviously you have to have some financial resources to help you in doing all this work. Now, who will be your target? According to the WHO, they set target audience. It is the young adolescents and their families, adult women, and community leaders and champions. And obviously, you have to engage men. The reason that, because the men, they are the ones who are transmitted the HPV virus, which is the main cause of cancer cervix, to the woman. And so first you have EUR that encourage the men, their partners, or the patient partners, sisters, daughters, mothers, to get screened for this disease and to get treated or to get vaccinated. encourage the men to use condom to prevent all sexually transmitted infection, including HIV, because as you all know, the condoms offer some protection against human papilloma virus. And then you advise the men to reduce the number of sexual partners if they have, and use condom if they have more than one sexual partner. So you have to get the men involved in your campaign. I know it's a disease of women, but it is very important to get the men involved in your campaign. Now, in order to develop your strategy plan, you have comprehensive strategy. From my point of view, first you have to make an access to the screening services in your area, and a patient have to have access to the treatment and access to vaccination if you have a vaccination program. Obviously, you include the palliative care. You can integrate all this into the family planning or maternal health to make it easy. And then if you have vaccination or screening, you have to assess the cost and how would you reduce this cost, obviously including the palliative care. In order to do this, you have to have a very well-organized functional referral system which links your screening services with the treatment in early cancer, the precancerous lesion, which is the best time to eradicate this disease by doing the smears, the cervical smears, or you have a treatment in the invasive cancer, like when they got referral to the main cancer center in your area. You have to obviously to monitor your work. You have to put monitoring system to track the screening figures, the follow-up treatment, your vaccinations, so you know where do you stand. And then if you develop a cancer research agenda, it will be very important because figures don't lie. If you have figures, you can have your research, and then you can convince people about your work. Now, there are some tips will help you in advocacy communication. Like if you get some patient, like I have a few patients who are already doctors or medical staff, and then they can speak about their stories and the pain they've been through and the advice how to prevent this cancer. And you have to get ready for your arguments and in unexpected opposition in your area, especially in this part of the world when we have a man-dominating society, and it is very emotional, very touchy. For them to discuss anything with female reproduction or sexuality, but you have to keep your message clear and sustained. You have to keep on going and never give hope. Now, for the facts and figure, of course, you will have each area should be ready to prepare their figures. How many cases you have per year, and what's the risk groups you have? Do you have them in your area, in order to assess the economic cost related to the disease? Now, if you prevent it, of course, it will be much economical than you treat an advanced cancer. Plus, obviously, the psychological effect of this cancer, which is it's not affect only the woman, but it will affect the whole family. One more thing is that you have to reach beyond your cancer community. You know, we doctors, medical staff, whatever, we speak to each other enormously and daily. Please go beyond this community, because the other communities, they don't have the clear vision as you do. So you have to go beyond your community, and especially if in low-income countries, you have to build up capacity and you provide them with evidence-based information, and you get involved the partners to include them in your cancer prevention, to raise fund for this campaign. And you have to, I always use these emotional messages to create the impact. You know, if you appeal, sometimes you have to appeal to the family, to the girls, to the women, in order to take this very seriously. Now, there are there are some aids to help you in your communication, like the booklets. I will mention the Imam Masjid. You know, here in Kuwait, or the GCC countries, they are Muslim countries, so many individuals, they get affected by the imam of masjid. When he talks to the women, he talks to the men, so please get him involved. Obviously, you have television debates and press conferences and radios and press release and phone campaigns as well. Now, there are the main challenges for me here is the misinformation. I continue trying to tackle this misinformation on the internet, many negative media reports, social stigma about the cancer, and patients are reluctant to discuss their reproductive health in general. But I always give them an example when the countries who have implemented their screen program and the vaccine, they have significantly reduced the burden of the cancer cervix. And one example, of course, now Australia, which is in the good pathway to eradicate this disease. Other partners you can involve the authors, the activists, and some support group, and the business leaders. Now, in conclusion, please take time to advocate for this devastating disease for women. Obviously, we know what to do. We know how to do it. So advocacy and communication intervention both can help to overcome this barrier. And please provide scientific evidence to about the promise of prevention must be translated in simple language to the audience, to non-medical staff, to obviously you will have it in their languages, whether it's Arabic or different other languages. Policies must be adjusted based on your circumstances, and new opportunities will come up, and the resources must be mobilized to ensure that everyone is protected against this preventable disease. Thank you very much indeed. I come to the end of my presentation.
Thank you very much, Dr. Iman, for this comprehensive talk. And now we would like to introduce Dr. Fatima Al-Hamlan. Dr. Fatima is a scientist in the Infection and Immunity Department at King Faisal Specialist Hospital and Research Center in Riyadh, as well as an assistant professor at the College of Medicine at Al Faisal University in Riyadh. She was a founding member of the Rufaida Women's Health Organization in 2016 and is its vice president. Dr. Fatima holds a master's degree in population genetics from Washington State University and a PhD in microbiology, molecular biology, and biochemistry from University of Idaho. She also completed executive education courses at Harvard Business School and Harvard Medical School's leadership program. Dr. Fatima is currently developing a network to advance women's health, women in STEM, and CSOs within Saudi Arabia and globally. Dr. Fatima will give us a talk about communication strategies to raise awareness, improve social acceptance, and ensure success of elimination efforts. We will address her recorded video.
Good morning, everyone. It's an absolute pleasure to be with you today. I would like to thank the organizers, friends of cancer patients, and all the partners who are working really hard to help in this issue. We all have this mission to eradicate cervical cancer, and one part of it is the community empowerment and the patient empowerment, and to improve the social acceptance of the preventive measure. And that's the only way to ensure the success of the elimination efforts. I'm Fatma Al-Hamlan. I'm wearing two hats today. I'm virologist and I'm working at King Faisal Specialist Hospital and Research Center. I have been working on HPV and cervical cancer in Saudi for over 10 years. And also we are using this data to advocate for the elimination of HPV in Saudi Arabia. And finally, the school vaccination program just started a few months ago in Saudi for females, and hopefully one day we will even vaccinate males. I'm also the founder of Rufaida Women's Health Organization, which is our advocacy arm. which we will talk about today. So we all share this mission in this forum for 2 days. We all aspire to eradicate cervical cancer, and we would love to reach a nation that's free of cervical cancer. And you cannot reach that level until you know the current statistics. And if we look at the cervical cancer facts, I'm sure we all know this information, as most of the cervical cancer cases are caused by HPV. But the good news is, if you look at the international data and the worldwide data, cervical cancer now is became number 4. So that's due to the vaccination, that's due to the cervical screening, which improved actually to drop the ranking of cervical cancer. However, our local data in Saudi Arabia, we are seeing different trend. Cervical cancer now is the 8th most frequent cancer in Saudi Arabia. It used to be number 11. And that's a worrisome. That's something that needs to be taken care of, and an action has to be taken. And thank God it's taken already and it's in progress. If we look at the GCC, as we care in this forum, at least for the GCC region, this is a study that we have done in 2017, I believe. We looked at 14 years of data from the GCC region. And if you notice at this pie chart, it's not the incident rate of cervical cancer that worry us, but it's the arrival of these cases as they reach the hospital in late stages. So as a result of that, over 48% of cervical cancer cases presented to the hospital in late stages. And what does that mean? Means low survival rate. And this is something is very important, as we see in Saudi Arabia. Whenever we are talking about cervical cancer, they would say, oh, well, the incident rate is low. We don't care much about the incident rate if the survival rate is very low. No women should die of cervical cancer. It's the easiest to prevent, and there is a vaccine, and there is a screening, and there are different tools that can prevent cancer. And this is our mission, to advocate for the preventive tools and to educate women to take care of their health and to go ask for the vaccination, and also to get screened and get checked. If we look at the outline of this talk, I will be talking about the patient empowerment. I will be talking about the co-production in healthcare and what does that mean. I will talk about the role of NGOs to promote health. This forum is led by an NGO, the Friends of Patient Cancer. They are doing an amazing job, and this is their responsibility in the community. We will talk about the role of NGO and how it's value-driven, and how the NGOs are the voice of people, and how they should lead the advocacy to empower the community so they will be active in pursuing the preventive measures and to take care of their health. Our local experience, I will share Rufaida's experience, and I will show you our strategy, how we are working really hard to be part of the elimination effort of cervical cancer. We need to change the culture, and what is our future direction? What is patient empowerment? Everyone is talking about patient empowerment. If you look at WHO definition, it basically defines the empowerment as a process through which people gain greater control over a decision. So people, they are in charge of the decision. And in order for the patients to be part of this decision, they have to be educated and they have to be equipped with the right knowledge. Because we always believe empowered patients, they take sound decision, and it should help the whole healthcare system. This is the old way. If you look at patients coming in the hospital, usually the patient is in the center, where they call it patient-centric hospitals. It turned out to be this is not the good model. We usually send a unilateral relation with this patient, where we just provide the services. However, what we aspire to be is to reach that level where the patient is a partner. He's one of the team who should help to take a decision and that should contribute to the best practice, making informed choices about the treatment and the care. They will have better relation. We always believe that if the patient is empowered, he will be more responsible, he will comply, he will adhere to the treatment, and that will result in a better health, and that will result in a prevention of the diseases. That's why, as we talk now, we have to talk to our community and they have to join this conversation to be part of it and to be responsible with us towards a nation free of cervical cancer. I will talk also about the co-production. So the model I showed you, it's kind of a co-production in healthcare system where the patients are partners, they are informed, they are part of the medical team, and that will provide the best service. It's exactly like a customer service. It's exactly like a business where you care about the customer and you always ask for his opinion and his feedback to serve him with a good product. This is the same thing should happen in the hospitals where the patients, they are part of the healthcare system, and that's where we need to work together to have the best outcome and the best treatment that patients need. So the approach, as I mentioned before, it's a value-driven, and it's built on the principle that those who are affected by a service are best placed to help to design it. We need to listen to our patients and let them be part of this mission. If we look at the framework of the co-production model, it's basically you have the patients and you have the clinicians and you have the infrastructure and the system that support this relationship. Having those three arms working together to co-produce a service that will give you the best innovative service, cost-effective, and everyone is happy and the patients are compliant and adhering to the treatment. They are aware, they are part of your strategy. You cannot design a strategy without having the most important stakeholder in your strategy, who is the patient and women in this case. So that's why we are working really hard to incorporate this model in our system. So what are the principles of co-production? How we reach that level of co-production and working closely with our community? It's basically we have to recognize that people are assets and we need to work together with them, and our strategy wouldn't work without them. Also building on people's capability. Developing two ways reciprocal relationships where we have to understand with respect, with high level of communication. Sometimes we underestimate patients and we think they don't know, they don't understand. We have to develop a language and articulate it in a way patients will understand our language. And also we have to encourage peer support. And also we have to eliminate the boundaries. We have to have an open conversation with the patients, and we have to educate them. We have to direct them from where they get the accurate information. Our problem right now is the misinformation, and especially with the HPV as a sensitive topic, as a sensitive topic in conservative society. It's really hard. Anyone can stop this dialogue between people in the community because it's a taboo, because we should not talking about it. We are not promiscuous. This is not for us. We don't have any sexual transmitted infections. So all this misinformation circulating, we have to end it in a scientific way, yet a friendly way that the community would understand and gain our trust. And we have to build this trust by circulating the accurate information and trusted information. And that cannot be done without the non-government organizations, without the civil societies. I always believe the civil societies, they have a huge role in the community. And again, as I mentioned before, we are the voice of people, and people, they trust us and they listen to us, and we should listen to them as we are advocating for them. Whatever questions they have, we are the one who talks to the policymakers and try to facilitate things and provide them with the best services that will help us all to eliminate cervical cancer. Worldwide, NGOs play an instrumental role in global health, as you all know. And also they master the community empowerment. Every NGO in every country, they should know their community and they need to set their priorities. And also, when you are advocating for something, you have to support it with policy and improved health practices. It's not like only giving health information or brochures or videos. No, it has to be actually at advanced level where you really transform the policies and support. In our case, it's women's health. Also, the NGOs have contributed to the development of community around the world. Usually, NGOs, they are part of other entities in each country, although they have to remain independent from the government. And this is how they gain the trust of people. Usually NGOs, when it comes to education awareness, they are more trusty and legit. So the current community empowerment methods by the NGOs, it's underlying the understanding the role of the patient. When the patient in the co-production model, he needs to understand exactly what is his role in the part. Again, the NGOs should educate the patients, and also the NGOs should be part of the design of the co-production, as they can explain to the patients what's expected and what's not. Health literacy, in our case, we are talking about HPV. There are so many misinformation, and this is our job to clarify and simplify the information. Digital literacy, HPV, mainly we care about the youngsters, so we have to develop creative programs that target the young population. Again, things are getting updated more frequently now with the policy, with the dosing, with the information. So we have to provide our community with the best information. Coping skill also, and the shared decision making and the presence of facilitating environment. One thing we have noticed, when you educate a patient and give him the information, if they go to the hospital with this information and they find out, well, that service, it's not even present, or they don't have it, or it's not accessible, you are killing your message here. And this is something we have to be really careful before we educate for something. We have to be sure it's accessible, it's there. It happened to us in Saudi with the HPV vaccination. We keep talking about HPV vaccination. However, it was not available in Saudi. So you cannot do this to your community. You have to be sure, if you are raising awareness with certain things, be sure it's provided by either the government or the private. I will talk about our local experience with Rufaida Women's Health Organization. It's an NGO in Saudi Arabia. As the name implies, it's about women's health, but a huge part of Rufaida's work is on HPV and cervical cancer. So the need is very high, as the information about HPV in Saudi is very minimal, and it was not easy to talk about. So the need is very high. Rufaida positioned itself to be advocate for women's health, HPV and cervical cancer in particular. We have a great relation with the policymakers. We have our annual forum where we come up with our studies and with our recommendations that we take it to the policymakers. And this is our effect on policy that will improve women's health. Here is, since we are talking about the strategy, how to eliminate cervical cancer, our experience with Rufaida is we have different arms when it comes to awareness on HPV. We have to be creative and we have to target different segments of the community as the age varies. So we have to develop content for social media campaigns, advocacy, where we talk to the policymakers. We have to do our own studies. We have to come up with our recommendation. University talks. We always go. In Saudi, we have one university. It's only for ladies, but also we have other private and government universities where we go and give talks and have this open platform where we can get questions and answer their questions in the presence of the experts. Rufaida Unfiltered Talk. This is an online platform. It's Instagram. Anyone can join. And I hope this is Rufaida's account. Please join, as there is a fresh talk just happened a few days ago with Dr. Ismail Al-Badawi. Again, it was open since it's Instagram. We get lots of questions. As women, they feel free to ask questions. It's anonymous. If you want to join with your name, that's fine. But we give this platform to just get questions. We care about the information more than your identity or the identity of the person who is asking. And this is actually something that we really developed in Rufaida. It's like we are a safe place to ask, and we are not going to judge any question you have. As the name said, it's unfiltered talk. It's sensitive issues. We know no one talks about it. Just please bring it on, and we will answer your questions, and the expert will answer your questions. Here is the social media campaign. We have hundreds of infographics correcting and rectifying some wrong information, giving more information. It's easy to download, and it's easy to send by WhatsApp different messages. We try to make it short. We sometimes add some links to websites. We write scientific articles that's written in a simple way. As you can see, the post engagement is over 35,000 in this January, and the engagement is really high. There is a video. I would invite everyone to scan the barcode. There is a video that's just released like a few weeks ago. And again, it talks about HPV elimination. And since it's just started in school, we are trying to encourage everyone. As we are getting circulating messages by WhatsApp, people are warning others from taking this vaccine. I'm sure in the GCC region, they are sharing the same concern, as we get random messages from people who is warning the others. People sometimes they tend to listen to these messages. Our role is to clarify these messages and also send the accurate information. Here is Unfiltered Talk with Dr. Nada Munshi and Dr. Ismail Badawi. As I mentioned, they are all experts in the HPV. Here is Al Faisal University's talk. The best way is to go to the students and get their questions and explain everything to them. More universities in Saudi that we are planning to talk about. And also the awareness station. We also provide all the information, not only stations and booths, but also we have a rich website that has all the information needed. Our mission is no woman should die of cervical cancer. The prevention is there, and our role we have to be active to educate women and utilize all the platforms that we have to end cervical cancer. Thank you so much, and I would be more than happy to take your questions. Thank you.
Thank you very much, Dr. Fatima, for your comprehensive talk. And now we would like to introduce Ms. Radhika Srivastav. Ms. Radhika is the Senior Director at Hriday, a nonprofit organization engaged in multidisciplinary research, capacity building, and campaigns linked to the prevention and control of NCDs. Ms. Radhika leads the Secretariat of the Healthy India Alliance that fosters engagement of multisectoral CSOs to address NCDs through meaningful involvement of CSOs, people living with NCDs, and young people. Mrs. Radhika holds 2 master's degrees in nutrition and public health. Welcome, Ms. Radhika, and the floor is yours.
Thank you so much. I'll share my screen. Are you able to see my slides?
Yes. Can you put it on full presentation mode, please?
Yes. Is that okay now? Right. Thank you. Thank you so much for having me. First of all, thank you so much to FOCP for giving this opportunity, to Hriday and to the Healthy India Alliance to participate in this consultation. I was listening to the presentations of Dr. Iman and Dr. Fatima with a lot of interest, and much of what they said is applied to the work that we do here in India. Before I start my presentation, I'd like to clarify that I'm not a medical doctor and definitely not a cervical cancer specialist or expert. Our work is as a civil society organization promoting NCD prevention and control among young people in India. But given, within our coalition, there are a lot of organizations who work on cancer prevention and control, and also with a focus on NCD or a focus on cervical cancer. What we are now trying to attempt to do is, integrate cervical cancer prevention messaging into broader NCD messaging, and that is what I'm going to be talking to you about today. So we are really looking here in this presentation on, what are youth-centric interventions, and how have they been successful in bringing about changes in NCD policies in our country, and how we can learn from those experiences. And as we try to, develop more, a program which is more focused on, sorry, I think there's an issue with my screen share. Can I get the prompt again, please, to share my screen?
Yes, just click on the screen. We can see it.
Okay, thank you. Right. Essentially, our engagement with youth has been from a perspective of understanding individual risk factors, interpersonal risk factors, and how does their environment influence their behaviors. And looking at it from a risk factor perspective, what are the individual behaviors, the community level interventions, and the policies and programs overall that can promote healthy and safe behaviors. And this is a model that we have. I will take the example in my country for tobacco control, and how now slowly and steadily, like I said, we're trying to apply this for cervical cancer work as well. So firstly, most important, the lesson that we have learned is that any work that we do on health promotion interventions has to be evidence driven. And this is, for example, this was several years back when our government was developing a national tobacco control program, and they did not include any youth component in the program. They were talking about different things, but there was no mention of youth engagement in the program. And that is when we shared our research findings from large-scale group randomized controlled trials, which were looking at which resulted in reduction in prevalence of tobacco use among school-going adolescents, that we were able to advocate with them to include a school health component and talk about capacity building of youth as advocates for tobacco control. And so our work has really evolved in translating evidence to action. And so right from the individual level, we look at what youth can do in the local communities, what can they do at the national level, and then of course what can they do at the regional as well as the global level, and engaging them as youth-led multi-stakeholders interventions of community mobilization. So again, just some examples of our school posters, building their skills to first look at what tobacco-free schools and homes can look like, and then building their capacities to look at, implementing laws or around tobacco-free educational institutions. Building capacities to talk about policies at their level. So undertaking a students' parliament on health, and what are the policies that are deficient in our country, and how can what are the laws that need to be amended or new laws that need to be passed. So through these innovative strategies, we build their capacities to be able to advocate in real world settings. And I'd like to share an example of that is in India, when we were fighting for large and effective pictorial health warnings in our country. There was a delay of more than 2 years, and it was our youth advocates who eventually took the baton in their hands and spoke to public health experts, spoke to our policymakers, and advocated for getting stronger in pictorial health warnings. And eventually, of course, with a lot of support from civil society, there was a lot of pressure on the government, and eventually we were able to get pictorial health warnings. Another, and then the next level is about, again, through this journey of advocacy, also building their capacities to represent voices of global youth. And so, for example, talking about endgame. So, for example, talking about tobacco endgame. And so if you see that, right from individual level interventions, we are slowly and seeing steadily over the years, seeing this trickling of the efforts from bottom up. So they start at a very small level, and then we build their capacities to go up to advocating at the global level as well. And this is a campaign that we had launched a couple of years back, which was the No More Tobacco in 21st Century campaign. This is closer to your region. In 2015. Abu Dhabi had hosted the 16th World Conference on Tobacco or Health, and it is these global advocates at that platform where they spoke about building tobacco-free future generations. So moving forward, another very important thing that we've realized is, and both Dr. Fatima and Dr. Iman spoke about misinformation. And in the case of cervical cancer, we've realized that one, of course, is misinformation, which is, more socially driven, because, it's something which is a sensitive topic. Many times it is considered taboo, and the situation is not very different here in India. As compared to your region, we also face a similar situation here. But what we have also tried to do is let young people identify what are, why are they being targeted, and how they need to look beyond the misinformation, so to say. So, for example, if the tobacco industry is glamorizing the use of tobacco products, how can they go and monitor and look at shops and say that, okay, this these are violations and this is something which they are blatantly targeting young people, and we as advocates need to take charge. So that's again one strategy. The other is about building and sustaining global youth networks. So again, we bring young people from across the globe, so youth from about 35 countries convene and talk about common issues. One thing we've realized is that it's very important to give them a broader perspective about it's not just their country or their state or their city or their community or their family who faces these public health challenges. It is, many of these challenges are global in nature, and we all need to learn and share from each other's experiences. This is the last Global Youth Meet on Health, which we organized during the COVID times, and we're very happy that there was very strong participation from youth in your region as well. Capacity building again is something which is very, very essential. We have been working very closely with the WHO office in our region as well as with UNICEF to build youth networks, to build their capacities on how they can make a difference. Now coming down, so what I've done is try to give a snapshot of how we can look at examples of the work that we have been doing up until now, and translating that into cervical cancer prevention, typically from the point of view of an organization who has been broadly working on NCD prevention and control, but we are just about starting some dedicated work on cervical cancer. So just to give very briefly a scenario in our country, cervical cancer is the second most common cancer in among women in India, and I think you would have heard this similar statements across the yesterday and probably even later today. India contributes to the largest global burden of cervical cancer, and it accounts for nearly 1 in every 4 deaths globally when it comes to cervical cancer. And so we've realized that as an NCD community, we need to start talking more openly about cervical cancer in India. And why has this why is the time opportune for us? So the last year was when Dr. Fatima also spoke about the immunization and HPV vaccination in Saudi Arabia. India has also now announced that girls aged 9 to 14 will get cervical cancer vaccines through their schools. And Dr. Fatima made a very, very important point about whatever messaging we give to our communities, they will be very disappointed if those services are not available. And so this is what you see, the Indian cervical cancer vaccine was just launched yesterday, and so it's I just included this in my slide this morning because it was just a coincidence that I was going to talk at this forum, and then this is a development that took place yesterday. The Ministry of Health has also roped in the Ministry of Education, and we have something which is known as the Central Board of Secondary Education in our country, under which the majority of the schools across the country are affiliated. So the CBSC, as they are called, have now released a circular that these girls will get vaccinated, and there needs to be the actual rollout of the vaccine is anticipated to start only from the mid of this year. But we have already started receiving messages from schools because they're absolutely frantic because there is, of course, a lot of misinformation about it. Schools are very apprehensive. How is it going to be targeted? Teachers, school principals themselves don't know about the issue of cervical cancer. And so slowly and steadily with our organizations in India who work on cancer prevention and control, who have years of experience on working in cervical cancer, we are now trying to roll out a campaign in schools so that before the vaccine is introduced, there is some movement which is created, which slowly and steadily reduces the hesitancy to take the vaccine. So something that we are very, very committed to in terms of working in India under the broader umbrella of NCD prevention and control. In terms of lessons learned, I would say what are some of the points that we're bearing in our mind as we try and roll out this work is, of course, meaningful involvement of youth is essential instead of just a tokenistic engagement. They need to be involved in developing and co-designing and co-producing, again, something that Dr. Fatima spoke about beautifully. Again, engaging young people not just as beneficiaries, but also as key stakeholders. We've understood that youth-led approaches yield better outcomes versus youth-centric approaches where we are working for them and not with them. We are looking at developing and testing and scaling up evidence-based interventions to promote healthy behaviors, which will be supportive of cervical cancer prevention and eventually, of course, elimination. Again, tapping into youth expertise for normalizing discussions on cervical cancer and promoting uptake of the vaccines, encouraging screening as per whatever guidelines are there, engaging the families and communities to address myths and misconceptions so that eventually, like I said, when the vaccine is vaccination plan is rolled out, then there is a demand to go and receive those vaccination. Promoting peer leadership and youth networks to create movement around cervical cancer prevention, and interventions and messaging, again, something I keep referring back to my previous speakers because I was, those thoughts that they were making were resonating so well with me. And Dr. Fatima spoke about keeping the interventions and messages gender neutral, engaging the boys, engaging the men as advocates for cervical cancer prevention, and of course also developing strategies on how to integrate cervical cancer messaging in broader NCD prevention and control interventions that we do. So if you're talking about broader NCD, so if you're talking about broader cancers or cardiovascular diseases, respiratory diseases, diabetes, mental health conditions, we intend to now specifically start talking about cervical cancer, because when we are talking about even cancers in India, broadly, we would talk about breast cancer, we would talk about oral cancers, but again, cervical cancer is something which is right now, the way we see it, it's just a bullet point. And we, from that bullet point, we want to sort of make it at the front and center of, important NCD prevention and control priorities in the country and the community, and, utilizing the expertise of young people in those efforts. So that's my presentation. Thank you so much for your interest, and I'll be happy to answer any questions. Thanks a lot.
Thank you very much, Ms. Radhika, for your comprehensive talk. And now I would like to introduce Ms. Fathiya Salama. Ms. Fathiya Salama is a director of pharmacy in a leading healthcare organization. She worked for 22 years in pharmacy field, and she specialized in activation of new healthcare services. She was awarded a Star of Excellence in Healthcare Quality, and she implemented the first digital pharmacy in Qatar. She's now leading campaigns to raise awareness about HPV vaccine and cervical cancer screening. Ms. Fathiya will go through a nice topic entitled The Importance of Early Screening and the Impact of Communication Delays. Ms. Fathiya, the floor is yours.
So I'd like to start my talk with some HPV or human papillomavirus facts. We have almost more than 600,000 women diagnosed with cervical cancer per year worldwide due to HPV-related cervical cancer. 80% of the population around the world will get infected by HPV at some point of their life. There are 79 million population currently infected with the HPV in the United States only. 14 million cases is expected annually in the States as well to be infected with the HPV. Can cervical cancer be found early? Yes, if all the women is encouraged to do the pap smear as per the guidelines, then we can find the precancerous cells, or we can prevent the cervical cancer by finding it very early, because unfortunately when cervical cancer found in a later stage, usually it's in another part of the body, and then the treatment is becoming very hard. We have almost half of the 600,000 infected women. They lost their life due to the late diagnosis. So I would like to share my story. In 2021, I was diagnosed with precancerous cells or carcinoma in situ and HPV type 16 high risk. The thing that I found it by incidence, I was doing like a general checkup for my health, and the physician at that time, she advised me to do a pap smear. And to be honest with you, despite the fact that I'm a healthcare provider, I was like hesitant doing it because I don't have any symptoms. So I thought it's unnecessary intervention. And then she was like, advising me strongly to do it, since I didn't do it since more than 10 or 15 years, and I missed it for 10 or 15 years. And I did it. And to be honest, I wasn't following up on my result, assuming it's going to be normal because I have no symptoms. But I got a call from her 3 days back, and the result was shocking, because she said immediately we need to do a colposcopy. And the colposcopy came back having the precancerous or the SEN3 with HPV 16, which is the high-risk virus that causes cervical cancer. And I have a big lesion with the SEN3. So I did a surgery removing the precancerous cells, and I was advised to do a colposcopy every 6 months, plus the HPV test. And the good news that my latest colposcopy, there was no sign of the disease. So they removed all the cells, and there was no sign that there is an HPV infection. So it looks like my body get rid of it somehow. And after this, I became an HPV advocate because HPV is a sexually transmitted disease, but I was like facing a challenge during my journey. My first friend, she's a OB-GYN herself, and I was talking to her about my diagnosis, and she said, "Do not mention this to anyone." And to be honest, that makes me very curious about knowing why. I am a victim, I am a patient, and I feel that there is no one like my right as a patient to be treated and to be speaking about the disease. And then I started to dig more in the researches, and as a healthcare provider, I have all the access to the literature. Originally, like, I'm a clinical pharmacist, so I know how to evaluate research, literature, and go through all the details and studies. And I find that HPV, yes, it can mainly be transmitted as by sexual transmitted disease, but there are some studies, new studies, that it can be also transmitted in other ways, like contaminated tools or whatever. So, and also in children, it's there in kids. So I felt that there is no shame about talking about it. And even the most important information, that HPV is not, that no one can really detect why you are infected or when. Why I become an HPV vaccine advocate? I have 4 kids, 1 daughter and 4 boys, and I decided with them, of course, with engaging them in the story, to get the vaccine. And they are going to get the vaccine, and I'm going to the plan with the hospital that they are going to administer the vaccine to the kids, to record everything. So I started a social media, in Instagram, as I know that many patients really using now social media, and the power of social media is very high to send a message to the public. And I started talking about my journey, the challenges I'm facing, correcting some of the misconception about the HPV. And here is a very short reel that
الإحصائيات العالمية أثبتت إن إحنا بنفقد سيدة كل دقيقتين بسبب سرطان عنق الرحم. سرطان عنق الرحم هو أخطر أنواع السرطان اللي بتصاب به السيدات. عالميا بيتم تشخيص 600,000 حالة سنويا. غالبا نص الحالات بتتوفى. دي مش مجرد أرقام. دي ممكن تكون أختي، أمي، صديقتي. ضروري إن كلنا نتكاتف ونتعاون مع بعض عشان ننشر الوعي المجتمعي بأهمية التطعيم ضد فيروس الورم الحليمي البشري، عشان نقدر نقضي على سرطان عنق الرحم وننقذ أرواح كتير.
So this is one of the short videos that I did. Also, I was invited by the WHO in launching the regional cervical cancer elimination strategy, and I shared my story and because I do believe in empowering the patients. Patients talking to patients is very important. Healthcare providers talking to patients is also important, but I feel that when the patient will see other patients talking, they will be encouraged to talk as well about it. We really need to remove the shame and the taboo behind this HPV. HPV virus is like any other disease. There should be no shame about it. It's very dangerous because it can cause cervical cancer and other cancers as well in women and men. And it's very important for us to empower the patients to talk about their experience and their journey, because once they start talking, you will find the gaps from their experience. Plus, if we stop talking about the HPV and make it taboo in our culture, this will kill the topic. If we don't speak about something, then there is no disease, and this is not the reality. The disease is there. It's very common. It's very common in both male and female, and also kids. And we cannot really stop talking about it because it's a sexual transmitted disease. So this I'll just share a few seconds from that.
أنا عندي 4 أولاد. عندي بنت و3 أولاد وهطعم ال4. انا اولادي يعني هم لما عرفوا الموضوع انا سبت لهم حريه الاختيار، وهم they went يعني هم الحمد لله well educated below 19. فعندي 19 years وعندي 16 و14 و12. فهم they go through literature. كمان كانوا قروا كتير عن الموضوع، والحقيقه هم نفسهم اللي طلبوا التطعيم. انا ما حبيتش ان انا تفورس عليهم او اضغط عليهم في حاجه هم ممكن يكونوا خايفين منها، لكن هم كانوا مؤمنين بالرساله. والحمد لله انا الاسره عندي العائله وكلهم كانوا very supportive للانيشيتيف. انه اتكلم، وبدات في السوشيال ميديا انه اعمل مور اويرنس وكامبينز، انه اتكلم عن الموضوع واشجع السيدات على الكشف المبكر، وعلى ان مفيش حاجه تخليكي ما تروحيش تعملي المسحه. ما فيش، لانه هي ما بتاخدش دقيقه في العياده، مجانيه في معظم الدول، كمان يعني هتنقذ حياتك لو اكتشفتي. و there is nothing wrong، ما فيش شيم، ما فيش خجل ان انت تقولي ان انا مصابه، لانه في so many ways ان انت ممكن يكون جالك، وممكن والفيروس ده اصلا شائع جدا، يعني almost 80 او 90% من البشر بيصابوا فيه في فتره. انا عندي 4 اولاد.
So I started to correct some of the misconceptions in our culture about the HPV virus. So this is from my experience, talking to patients. So if my partner has an HPV, this means that she was, cheating me, or he was cheating me, and unfortunately, some of the women are starting to point fingers toward their partner, and they reach a stage that you find families falling apart because of the diagnosis. This is totally wrong. HPV can be there in the body for years, even before you are getting married or before you started your relationship with your partner. So it's unfair to point fingers and say, okay, I'm infected today, this means that you cheated me yesterday, or you yesterday. This is not correct, and the nature of the virus itself needs to be clarified to the public more, to understand that this virus can live for decades in your body, and then due to any reason, like your immunity went down for any reason, it starts to be active in your body after being dormant for so many years. So this is very important, because it really affects our community relationship and the marriage, and many families actually falling apart, having kids due to being diagnosed about the virus. So it's very important to talk to partners once the diagnosis is there. It's very important as well to have a kind of education and a kind of counseling, family counseling, with the husband and wife together, to let them understand the nature of the disease, in order to keep this family together, and not to fall apart because of a misconception or a wrong information. HPV is a rare infection. So many of the women, when you talk, or the men, when I start talking with them, they think that I'm the only one who have the HPV. This is not correct. So HPV, more than 80%, and all the researchers is now talking that HPV is going to be infecting 90 or 80 to 90% of the population around the world. Plus, it's very hard to, there's no test for men, and I feel that many men, they have also they are carrying the HPV virus without having symptoms. So it's not a rare infection. I mean, any one of us will be infected at some point of their life, and that's why we need to educate the public that they need to have to be vaccinated at early, as soon as possible, and then vaccinate their kids from 9 years to 26, and like the full vaccination needs to be given, because you are protecting them from the cancer, and also we're 100%, almost 100% sure that they are going to get the infection at some point of their life. So women with abnormal Pap test should get their male partner to test for the HPV. Also, this is a question that I got from the public. There is no, as I mentioned earlier, there is no test for male for the HPV, and that's why the only way to protect the male is from cancer is to vaccinate them. For women, even if she missed the opportunity to be vaccinated for any reason, still the pap smear can, save her life from cancer. If she's following up with the pap smear regularly, then she can be diagnosed early enough before she gets in trouble with the cervical cancer, and before the cervical cancer become in a late stage. But for men, unfortunately, the only way to protect them against the cancer is to get the vaccine, because there is no test for men to, to check if they have the virus or not. Also, things that I'm trying to, to let all women should know about is women don't need to feel ashamed about HPV. It doesn't mean that you are you were diagnosed with the HPV that you did something wrong. You're right as a patient that to be treated, and you're right as a patient that the doctor shouldn't really question you some personal questions, and you don't have to answer them. Your right as a patient is to be treated and to get the vaccine and to be screened. Also, it doesn't mean that you are carrying the HPV, that you did something against the culture belief. It can be dormant in your body for so many years. You can get it while you are a kid and then diagnosed later in life. So it doesn't mean that you did any kind of behavior that the culture can point finger on you. So HPV virus doesn't only cause cervical cancer, and this is something that the woman they say, okay, what if I remove my my cervix, or did a prophylactic surgery so I protect myself? But we can say that also HPV is linked to other cancers as well, like the head and neck cancer and the throat. So there are so many other cancers that HPV is linked to. So we need to take the vaccine to protect us not only from cervical cancer, but from other cancers as well. The vaccine saves life. Yes, the vaccine will save your life, definitely. It's effective for protecting you, almost 90% effective to protect you from the cervical cancer and other cancers. But it doesn't mean that we need to rely on the vaccine only. Even if you miss the opportunity to be vaccinated due to your age, do not miss the pap smear. So both of them needs to be in parallel to fully protect you from the cervical cancer. Thank you for listening, and I hope that that you enjoyed the talk.
Thank you very much, Ms. Fathiya, for this nice presentation. We will have a coffee break for 15 minutes, and we will resume our forum at 11:35 sharp UAE time. Please stay online. Good morning, everybody, and hope you had a lovely coffee break. Now we will resume our forum with the fourth theme, covering the topic of shared experiences from the healthcare field in the EMR region. This theme will be covered by Dr. Mohammed Ben Azouz from Morocco, and then followed by a panel discussion. We would like to introduce Dr. Mohammed Ben Azouz. He's a medical doctor with a master's degree in health administration and public health, Department of Health Program Management, National Institute of Health Administration. Dr. Azouz, he was the head of the National Immunization Program, and since 2022, head of the Child Health Protection Department. Dr. Mohammed is a member of the National Technical and Scientific Advisory Committee on Immunization, the National Scientific Committee for the elaboration of the vaccine strategy against SARS-CoV-2, several ADHOC committees related to immunization, InfoVac Morocco, with several representations of his country of the meetings with WHO and UN. Dr. Azouz Ben Azouz, welcome, and the floor is yours.
Good morning, everybody. It's a great opportunity for me to share with you the experience of Morocco into introduction of the HPV vaccine in the national program. Let me to share with you the screen. By the way, in Morocco, we are talking about more than 13 million of women aged 15 years and over who are at risk of developing cervical cancer in Morocco. Per year, approximately 3,000 cases are expected of cervical cancer and about 2,000 deaths. Cervical cancer is the third female cancer with an incidence of 9.5 new cases by 100,000. Several studies have showed that the prevalence of the HPV infection in Morocco varies by regions and groups, human status of VIH, nature of the sample, and histological grade. Given this information, and in the absence of the specific interventions to prevent cervical cancer, we will unfortunately end up with an alarming figure by 2030. We will approach the figure of 500 women who are at risk of dying following cervical cancer. Of course, this could generate in terms of drama. Vaccination against HPV is included in the strategic plans of the Ministry of Health since the first cancer plan development in 2010 until the last government declaration in 2021. Several strategy and plans have mentioned the need to introduce the HPV vaccine into the national immunization program, given the interest it can generate. This intervention align with the global strategy to eliminate cervical cancer by 2030. This strategy is based on three objectives or bands: achieve a coverage rate of over than 19% of girls under 19, ensure adequate screening or more than 19% of women between 35 and 35 years old, provide care of to more than 19% of diagnosed women. The introduction of HPV into the national immunization program, therefore, followed several steps. First of all, from 2010, several meetings of the National Committee of Vaccination were held, which ruled on approved the introduction of this vaccination in the national schedule. An introduction and communication plan were developed in 2021, and there was the acquisition of the vaccine. In 2022, the vaccination strategy was revised in September, and in September of the same year, there was the deployment of all means and all resources to launch these vaccinations, which was actually launched in October of last year. To ensure this vaccination, major acceptability studies have been carried out. The first during 2015, and which showed encouraging results of regards the acceptance of mothers at around 76%, and the acceptance of fathers is around 69%. The reasons given are the fact that the vaccine prevents cancer and the safety of the vaccine. The second study carried out concerned 150% and was carried out in 2021 during the period of the vaccination against COVID. This survey showed that the opinion is subdivided into 4 segments or groups. The first segment represents 24%. They are the people said to be disconnected. This is to say that there are no information either on the vaccine or the disease or the consequent means of the prevention and in occurrence the vaccine. The second segment is a group called the pedants. Is the patient who said that know everything and claims, for example, they were in that there is a vaccine for all diseases such as hypertension, diabetes, and other diseases. The third segment represents 19%. That's the people who are worried. Those are the people who need to reassure with clear message about vaccination. And the third segment, the serene, are people who have clear idea about the disease, the virus, and means of prevention. We asked several questions to the respondents, and we choose the most important, namely of cause of cancer. As we can see, the vast majority of people believe that cervical cancer is due to sexual relations, a lack of hygiene, or a genetics problem, while the problem of causality between the virus, HPV virus, and cancer is not responded by only 1% of respondents. The second question concerns the means of prevention against cancer of the cervix. The majority mentioned that it's a problem of hygiene, either physical or food, but vaccination is mentioned in only 4% of these interviewers. The third questions concern the acceptability of vaccine. 94% of patients estimate that they could accept the vaccination, while 12% do not plan to have their child vaccinated at all. The obstacles of vaccination, first of all, is the effect of the and the consequence of long-term vaccination, sterility, health problem, also the effect of the vaccine on growth, and there are who consider that vaccination at an early age represents an obstacle to vaccination. The fifth question concerns the role of the school. The fifth question concerns the role that the school can play. 89% of people consider that school could play an important role in raising children's awareness, and 61 want to be their children vaccinated in a public hospital, 80% in dispensary, and only 70% prefer to vaccinate their children in school. The Ministry of Health, with the partners, had developed a national plan for introduction of HPV vaccine, with an ambitious goal to reach a vaccination rate against HPV exceeding 19%. The introduction plan is based on five strategic areas. The first is supply and cold chain. The second is training and quality of service. The third is management and partnership. The fourth pillar of strategic approach is monitoring and research, and the fifth area is communication and social mobilization. An overview of the vaccination program and the prevention strategy, first of all, is concerned girls aged 12 years, and we currently using a vaccination strategy in the primary healthcare establishment. There are several actions that we have been put in place, like training of health professional, production of communication and training support and guide, established in a joint circular with Ministry of Education, and set up a specific system of monitoring vaccination. As we can see, there is the vaccination launch circular, the joint circular with the Ministry of Health and the Ministry of National Education, to allow health professionals to use school space to inform parents and especially students. There are communication materials that have been developed, practical guide of health professional communication materials such of frequently asked questions and posters and brochures. Thank you very much.
Thank you very much, Dr. Benazouz, for this impressive talk. And now we will move to our next speaker. It will be a panel discussion covering the topic of countries' experiences, lessons, challenges, and future prospects. This panel discussion will be moderated by Ms. Reem Ahmadieh. Ms. Reem Ahmadieh is a global public health professional with experience in communicable and chronic disease prevention and control. Her expertise includes policies, communications, advocacy, governance, and governance, and multi-sectoral partnership. She has worked with consultancy firms and UN institutions in Switzerland, Lebanon, and Dubai. In Lebanon, she worked on immunization projects, developed an EPI legacy with WHO, and planned and executed the national measles campaign to respond to the 2018 outbreak with the Ministry of Public Health. As a licensed clinical dietitian, Reem has public health expertise in health promotion. With a focus on the GCC region, she worked with the World Obesity Federation to develop formal guidelines for the management of obesity. Since joining GHS, she has been involved in facilitating events and campaigns related to public health. Ms. Reem, the floor is yours.
Thank you, Ms. Micheline, for the introduction. I would like first to introduce the panelists with us today, starting with Dr. Busaina Ben Alayla, consultant family physician and the head of non-communicable diseases and mental health in the Ministry of Health in UAE. With her extensive experience in non-communicable diseases and mental health, Dr. Busaina is a leader in the field of healthcare in UAE. Her contributions to the field, including the launch of WHO ISH CVD risk assessment tool in 2015, and her work on the development of national plans for diabetes and obesity, cardiovascular disease and cancer control for 2023-2026, have made a significant impact on the health and well-being of the people of UAE. We also have Dr. Hadi Abu Rashid, scientific advisor and head of the Cancer Awareness and Professional Development Department at the Qatar Cancer Society. Dr. Hadi is a valuable asset to the Qatar Cancer Society, where he serves as the scientific advisor and head of the Cancer Awareness and Professional Development Department. His extensive experience in clinical research and his involvement in several organizations such as the Gulf Federation for Cancer Control, the Union International for Cancer Control, World Cancer Day Advisory Group, the World Ovarian Cancer Coalition, and the All-Can International have made him a respected voice in the field of cancer management. We also have from Morocco, Dr. Lubna Abu Salham. Dr. Lubna is a highly accomplished public health expert with a master's degree in public health. Her contributions to the management of several health programs and the development of the National Reproductive Health Strategy 2010-2019, as well as her role in the coordination of the National Early Detection of Breast and Cervical Cancers program, have made her an important figure in the healthcare system of Morocco. Dr. Lubna has been the head of Cancer Prevention and Control Unit in the NCD department since 2019. And our panelist, Dr. Emna Al-Hajji. Dr. Amna is a consultant gynecologist and obstetrician at the National Center for Disease Control in Libya. She earned her fellowship as a consultant gynecologist and obstetrician in 2008 while completing her interim at Al Jalal Hospital, the only medical center specialized in obstetrics, gynecology, and maternity healthcare serving the entire Tripoli in Libya. She is currently teaching staff at the Arabic and African Academy, and she is responsible for the reproductive health in the National Center for Disease Control since 2020. She is an active member of, at the Arab Board of Health Specialization, objective structured clinical examination in obstetrics and gynecology since 2008. In this panel discussion, we will delve into the experiences, lessons learned, challenges faced, and future prospects of managing cervical cancer in your countries. The panel will consist of bright experts who have been working on cervical cancer prevention and HPV vaccination efforts from a variety of national perspectives. And the discussion will cover the current state of cervical cancer, the challenges and successes in managing it, with a focus on availability, accessibility of HPV vaccines, etc., and future prospects for vaccine introduction and rollout in UAE, Qatar, Morocco, and Libya. Welcome to all of you, our panelists today. I would like to start with one question for all of you. My question to you is, given your expertise and your national perspective and having worked extensively in this field, can each of you share an overview of the current cervical cancer situation in your country? And we could start with Dr. Busaina first.
Assalamu alaikum. Thank you for inviting me for this highly important forum, and it's always a pleasure to be with you. If we look at UAE is considered a low-risk country of cervical cancer, where we have the age standardized incidence rate of 2.96 per 100,000, and cervical cancer is ranking number 7 as the most common cancer among females, and number 6 as the most common cause of death among females. Despite that, UAE was very proactive as considering cervical cancer as a public health problem and adopting the WHO resolution on considering the cervical cancer elimination strategy to achieve 90-70-90 target by 2030. Thus, UAE developed a national screening program in 2014 according to the standardized international guidelines. Also, it's launched the National Cervical Cancer Registry since 2014, and it has been updated on yearly basis, and it plays a very vital role in providing and monitoring the quality of data on cancer. And also, as you know, UAE is the first country in the East Mediterranean region to launch the HPV vaccine through their national immunization program among the school girl children, and will share with you our future plan also on HPV vaccine in the next question, inshallah.
Thank you, Dr. Busaina, for sharing this overview. I think this is in a nutshell. We all are proud of UAE's progress and the efforts that they are exerting for cervical cancer elimination. We can move to Dr. Hadi. Dr. Hadi, please, the floor is yours.
Thank you so much for inviting me to be part of this very important event. Actually, I've been listening to the talk since yesterday, and the discussion is very important, and I think we really need to have all this momentum and let's say putting the head of multiple great experts and great experience together to push the agenda in our region for the HPV vaccination and the, let's say the elimination of HPV, reducing burden of cervical cancer in the region. Regarding the burden of cervical cancer in the state of Qatar, and not only cervical cancer, HPV, as we are all aware, it's play a role in a variety of cancers, colorectal cancers, head and neck cancers, and so on. But in particular, regarding cervical cancer, the topic of our forum. So instead of Qatar, the age standardized rate per 100, it's 7.2 per 100,000 population. That's kind of put it in a figure of numbers that will be comparable to other countries. Mortality-wise, it's 0.2 per 100,000, the age standardized mortality rate. If we're looking at the females, top 5, or let's say top 10 regarding incidence in the state of Qatar, cancers affecting women in the state of Qatar, and that's including citizen and resident in the state of Qatar. Cervical cancer is ranked the 5th. Regarding data and having the information regarding the burden of cervical cancer, the registry exists in Europa in a population-based cancer registry in a robust way since 2011. Before that, it was more hospital-based registry. Still, there is no HPV per se registry. I would say tracking significantly of the data of the HPV. And that's kind of regarding the screening aspects. We in Qatar, we're providing opportunistic cervical cancer screening done in the primary care centers using liquid biopsy and with HPV testing, combined with the HPV testing. And for the vaccination is actually this. I think the next month will start the HPV vaccination in the clinic based, not school based. It will be gender neutral in the clinic. Back to you, Masrim.
Thank you, Dr. Hadi, for sharing this overview. And we can discuss further the future plans in our next questions. Now moving to Dr. Lubna. Dr. Lubna, if you may please answer the same question.
Good morning, everyone. In Morocco, cervical cancer is the third cancer in women. We have standardized incidence about 9.2 cases per 100,000 women, and the elimination of this cancer as a public health issue, like the recommendation of the global strategy, was held and constitutes one of the priority of our 7th National Cancer Plan, and we adopted all the objectives of this WHO called 1970-90%. But we do have a lot of challenges. The main challenges is the awareness, like we discussed, was discussed in the first session, really to raise the awareness of women about the importance of vaccination, early detection, screening, and treatment of precancerous lesion is a real challenge in our country. And we are currently about the implementation of early detection program and cervical cancer screening program based on HPV testing. We performed the screening with the VIA technique, but currently we are working to implement the HPV testing screening program. Over to you.
Thank you, Dr. Lubna. We can now move to Dr. Amna, who's also with us on this panel. Dr. Amna, can you hear us? I'm not sure if Dr. Amna can hear us, so let's move to the next question.
Hello.
Hi, Dr. Amna.
Hello, good morning. How are you?
I'm good. How are you?
Alhamdulillah. I am Dr. Amna Haji. I am consultant gynae and obstetric, and I am responsible for reproductive health program in NCDC Libya. I will start to talk about the cervical cancer in Libya. Cervical cancer is very low incidence in Libya because we are entered the HPV vaccine from 2014, and we are given to the girl at the age of 12 to 14, and we have awareness in Libya in every years, but from the NGO, not from government, but we have pap smear and early diagnosis program. Like this program, it's sometimes it's present, sometimes no, because we have very big challenge in our country from the war, and we don't have good management about the cervical screening program in our country, and we need support from the WHO about this point. But alhamdulillah, we have just 241 patients with cervical cancer in every year. So it's not highly incidence, and the prevalence is very low in our country. But we want to do it cervical cancer elimination program in Libya, and we will start this program from the NCDC in this year's to put it free for charge for every woman. She can do it pap smear, but in nowadays there is no free in Libya. We have pap smear, but in the private clinic, not in the hospital, and not in the primary health care. That's why. But alhamdulillah, we have very low incidence of cervical cancer in Libya. Thank you.
Thank you, Dr. Amno. Now we can move to the next question. What have been the main challenges and successes or key lessons learned in managing cervical cancer in your country? So I will start also with Dr. Busaina, and we can follow the same flow.
In UAE, the most important challenges were the vaccine hesitancy. In the beginning of the HPV vaccination, there were great hesitancy, and it was mainly due to the lack of awareness among the healthcare providers, among the parents, the teachers, the students, the teenagers, and even the community. So UAE, to have this successful story, started by digging and determining the causes of these myths and these disbeliefs, and started by encouraging and raising the awareness among the healthcare provider through multiple scientific workshops, multiple training programs on counseling skills, how to give the messages to the parent regarding HPV vaccine safety and the role of HPV vaccine in the life of teenagers to prevent cervical cancer. And also we have involved the media. We have started by intensive media campaign to spread the unified message among the whole country that HPV is a safe vaccine, and also we reframe the message that it started by STD prevention, but there were a lot of hesitancy, and then we have changed it to cervical cancer prevention, and also we have encouraged the woman to be more proactive to reach for cervical cancer screening and to have early detection and early management. And we are looking that there are a lot of key lessons from this successful story, that the collaboration and the good partnership with the multiple stakeholders and to have one vision and one mission, which will enable all the countries to have a successful story like UAE. And back to you, Reem.
Thank you, Dr. Busaino. We can now ask Dr. Hadi the same question.
Thank you, Reem. I think we are in the region. We have the same issue. with same like UAE and Qatar, and I totally agree with the point that Dr. Buthaida mentioned. Is at the beginning is the hesitancy. I mean, it still exists, the hesitancy toward the vaccine among the public and the healthcare professional, that due to lack of knowledge and not having full understanding, and also the misinformation that around the HPV vaccination. And there has been an effort increasing, and the public actually, been studies even done also here in Qatar, that the parents, when they receive the proper information, their level of acceptance for the HPV vaccine go as high as 80%. So, and it's documented in an intervention-based awareness study done here in Qatar. And so we really need to invest more awareness for the public and for the healthcare professional. And for the public, we need to have this multi-setting approach, and a multi-method multi-setting is at work, at the education place, school-based, at the university-based, and also at work, workplaces, especially in the GCC. That's a great exposure through these location. We don't usually tend to have this, the community approaches. The community big event is usually it's easier to access through school, work, and university. To target it, and also using social media nowadays. I think the pandemic created this investment in the pandemic. So anyway, I'm not going to go into the more future plan, but the biggest challenge, awareness, the knowledge, the perception, and also the communication methods of the healthcare professional when they recommend the vaccination. That's also a tricky part.
Thank you, Dr. Hadi, for your answer. Now we can ask Dr. Lubno.
Yes, for me, for Morocco, maybe the key success is the political commitment. I think to have a leader to follow and to enhance the commitment of all the stakeholders is very important. Good coordination with all stakeholders is also very important thing to implement and to succeed in this implementation. The second point is the budget securization. Like we do in Morocco, we begin with the only project, and progressively we can secure the budget for the vaccination. As my colleague said, Ministry of Health is the first and the only stakeholders for the vaccination financing. Also, the healthcare facility availability is very important for the case management, and for the challenge. And as my colleague said, the communication and the awareness for me is very important. And I appreciate in the first session the story said by our colleague for the perception of the HPV infection and precancerous lesion. And if you allow me, I would like to tell you also the story with my sister, which was also diagnosed with the precancerous lesion with HPV infection. She is high educated, she is veterinarian, and the first worried for her is not the precancerous lesion, but the issue was how she was infected. So she was all the time asking how I was infected, and she lost so much time on this. So I think the first issue we have to work on is this demystification of this HPV infection. It's an infection we can get the virus about many ways, and we have to focus on the infection, the prevention, and early detection. Thank you.
Thank you, Dr. Lubna, and thank you for sharing this story as well. Now we can move to Dr. Amno.
أيوة السلام عليكم. We have a very high incidence of HPV infection in our country in this year. If we are comparison between the population before 15 years and nowadays, we have very high incidence of HPV. If we are looking data on the media and we are many lectures about the vaccine and we are pushed the vaccine. We have big problems in our country. We are the HPV vaccine, but the use to give the health care. That's why this is big problem in our country. So in next month we will start of awareness month about the HPV infection, and we are give good view about the HPV vaccine in our country. So to reduce.
Okay, I would like to shed lights on the common answers that you all had. So basically, the challenges that include low acceptance rate, lack of awareness, and then also vaccine hesitancy amongst parents, and the importance of coordination among stakeholders, and also empowering media and leveraging social media platforms to raise more awareness. I would like to ask a question, and feel free to answer. So based on our presentations yesterday on the 90-70-90 strategy and the regional strategy that was developed by WHO EMRO, what are your thoughts on its relevance to the regional context? And do you think that it will address these common challenges that you just mentioned right now? Feel free to answer. So this question is for any one of you.
Okay, can I answer? I think the global strategy of cervical cancer elimination is highly related to the region and even to each country, and it should address the challenges. Already some challenges already included, and it has been revised by all the countries in the region. All the challenges has been addressed, but I think each country will start to implement it. They will learn from other countries' challenges and what are the obstacles that has been there and what are the solutions they have done to overcome these challenges. So I think we have to share our experience. Everybody should learn from the others. And if we collaborate together, I think the strategy is easily can be implemented with all the collaboration from different sectors and with other countries in the region. Thank you.
Thank you, Dr. Busaina. And honestly, I had a question for you specifically, given that UAE has been working on various fronts to manage cervical cancer and rollout of the HPV vaccines. So now that you've mentioned that the importance of sharing valuable key lessons and knowledge, do you think there is any valuable key lesson that you learned from UAE's journey that you can share with the panelists today?
Yeah, sure. In UAE, the most valuable key lesson is the high political commitment. In UAE, we have a very high political commitment, which was behind the successful story of our HPV program. And also, health sectors cannot work alone. Any health sector cannot work alone on cervical screening and on HPV. It's the collaboration and the partnership with multi-stakeholder supported by the political commitment, which has included in its national agenda, and it was supported and being evaluated and monitored by the Prime Minister Office on the outcome and the situation, the ministerial decree on HPV vaccine, and even recently we'd like to announce that maybe within 1 month we'll announce the vaccination HPV for the males, for the male school children, and also for different categories from the community with after having medical consultation. So I think the high political commitment, the partnership and collaboration, and having unified vision and mission among the country will sustain our UAE successful story in HPV. And I think one day we'll reach that cervical cancer won't be considered a public health problem. We'll reach the 100% vaccination, inshallah. Screening won't be highly important. And as we all know that no woman should die from cervical cancer or to suffer from the complication of cervical cancer. So all should work and to have one mission to tackle cervical cancer from the world.
Thanks a lot. Thanks a lot, Dr. Busaina, for this insightful answer. And we are all working towards a common goal, and hopefully one day we can achieve it. Let's see if Dr. Emna is back with us. Dr. Emna, can you hear us?
Yes, I am hearing you.
Okay, I will repeat the question that we wanted to ask you earlier. So what do you think have been the main challenges and successes or key lessons learned in managing cervical cancer in your country, in Libya?
The biggest challenge for this cervical cancer elimination program in Libya, we don't have pap smear free in the population, so we have just pap smear in the private, and in the private it's highly expensive for the normal population. This is the first point. Second point, we have HPV vaccine, but many families refuse to take her kids to take this vaccine, and we are bringing this vaccine with the very expensive in for our country in this situation, but we reach many doses, it's expired and it's not taken with the girl. The big problem for us, we are give this vaccine just for the girl and we are not give to the boy, and the HPV infection is spreading to the family from the boy, not from the girl. This is the problem. We are trying to put it the vaccine for the boy and the girl at 12 years, not just for the girl. This is the first point. We have, we need some support from the government about the cervical cancer program to put it every year for the family free. We need it, but many people they don't know what's the pap smear and what's the cervical cancer, because we have very low incidence of cervical cancer. But the problem in our population, HPV infection, it's increased nowadays. We have a study in NCDC. It starts from February about the HPV genotype in Libya, to know what's the type of HPV in Libya, and we are trying to just to press on the government to start the free cervical cancer elimination program in Libya. Because all our in the government, they said there is no HPV infection in Libya, there is no cervical cancer. We have very low incidence, but we don't have data about this problem. We have registration, but this registration is very poor. I am trying to collect data from the registration center about the cervical cancer. We have just for 2020, and they are writing for me just we have 40 cases of cervical in Libya, and it's very low if compared with the another patient we are presenting in the hospital, in the TMC, or in the another center. So we will try to do it very good database in Libya about the number of cervical cancer in Libya, and we need supporting of all the girls to take this HPV vaccine. We have 240,000 doses. It's reached in our country on the March. So I will start for this one awareness about the HPV vaccine, and will give a very good view about the HPV vaccine and the important to take and give it to all girls in the age of 12. So I will take the target of this awareness to the family more than the girls, to push all the family to take her girls to take this vaccine. And inshallah, we hope to reach the best in our country. We have many challenges here. Thank you.
Thank you, Dr. Amna. We all agree with you about these challenges that need to be urgently addressed. Now I will move to the other question that I had for all of the panelists about the future prospects of cervical cancer management, and how do you think we can ensure that the cervical cancer elimination efforts are sustainable and can be maintained over the long term? So let us start with Dr. Busaina first, and then we move to Dr. Hadi.
Thank you, Reem. As I mentioned earlier, that UAE support the global strategy to eliminate cervical cancer 90-70-90. Today, for the last year, we have reached vaccination of 82% with 2 doses among the school girls, despite the pandemic before that, despite the challenges. So I think we can reach the targets. As I mentioned, that we hope that cervical cancer won't be considered anymore as a public health problem. And if we strengthen our screening program and we make it as a national, not just opportunistic, and we have the recall system for every female when she reaches the standard, the required age or the target age group to do the cervical screening, she has to be recalled to come and do the screening. And also we have the co-testing, HPV and the pap smear, so we have a good result. Also we have, alhamdulillah, advanced qualified hospitals treating according to the standardized international guidelines. So I think we'll reach the target soon, inshallah. We can reach the vaccination and even the screening and even the management if we detect it early. So no woman should suffer from cervical cancer. Back to you.
Thank you, Dr. Busaina. Now Dr. Hadi can share with us his answer.
So I'm gonna stress on the point that you mentioned, which is it's one of the things that I always it's one of my area of interest is sustainability and efficiency. So when we want to do something, we need to think of it before as we are planning, we need to plan in a way to be sustainable and efficient. So this is one of the things we need to, and that's where the research come in, and that's where we need to really do more and more burden studies and cost effectiveness. And it's clear, worldwide, no need to do more further. I mean, at the worldwide, there is a lot of protocols and initiative, but one of the things is when you want to invest in any public health initiative, to first get all the support that you need to have to make it sustainable, and to continue in a way that having all the vaccination and actually gender neutrals and school-based age, having this data system to monitor and evaluate your initiative, tracking all the data, also moving from opportunistic to national-based cervical cancer screening, and all of that is people to sit on the same table, and as Dr. Libna mentioned, and also Dr. Busaina, you need political will and all people sitting on the same table. And we have this in Qatar. We've been part of the National Cancer Program and the Governance Board. There's a lot of agreement at the Ministry of Public Health, also people sitting and pushing the agenda forward. So having that sustainable initiative coordination, people all agreeing on the same agenda, unified message, and basing all of our decisions on to be data driven, and keeping the concept of efficiency in every step, and the well-being of women. When I say efficiency, is not measuring the whole concept of efficiency in cancer control, with the main to be people-centered. So it's not just we're talking monetary or money. This is when we are averting a DALY or disability adjusted year of life for women, and being when they are back in the community, we're not talking about one person. We're talking about the whole family, and that's where we need to think forward, to plan and to think efficiently in a sustainable way. Back to you.
Thank you, Dr. Hadi. Now, Dr. Lubna.
Thank you. I am totally agree with you, Dr. Hadi. It's really the big issue and the main challenge. To answer the first question, is about the barrier. I think we all, as Arab, Muslim, and all this region, we have the same cultural barrier, and we have to work hard to fight and to enhance the awareness of the population. We have also to enhance and to improve the integration of reproductive health services in Morocco, to implement the cervical cancer screening based on HPV vaccine. We know that it will be costing much more than the VIA. As you know, the VIA, one liter of acid acetic is cost about $9 or $10, and we can screen more than 1,000 women. And to implement the HPV testing, it will cost more than $30 or $35 per woman. So it will cost too much for our country and in our mid-income city. So we have to think about the integration of reproductive health and to create the linkages about other programs and services like HIV, who have already the gene expert machine, and to work together. And as you say, Dr. Hadi, to be efficient in this implementation. To answer the last question, Reem, we can't, as you know, the HPV vaccination will give the results in maybe 20 years. But now we do have a lot of women with the HPV infection, with precancerous lesion, and also with invasive cancer. And for this, we have also to enhance the quality of services in management, in case management, and in the affordability of care services. Over to you. Thank you.
Thank you, Dr. Lubna. I appreciate all of your efforts, and I really hope we can keep the momentum to achieve elimination, even if it was after 20 years. Let's move to Dr. Amna. Dr. Amna, we are asking about the future prospects, and how do you envision the future of cervical management, of cervical cancer management? I'm not sure if Dr. Amna can hear us. Meanwhile, we can move to I had one question for you, Dr. Hadi. So I want you to speak to the role of Qatar Cancer Society and how it contributed to raising cervical cancer awareness and management in Qatar.
Thank you so much, Shane, for this question. And I'm going to answer this question in a two layers. The broad that all, so what actually patient organization or cancer societies or NGO could play a role, and also what QCS has been doing. I will go back and forth in those two kind of layers for the answer for the question. So what we have been doing as Qatar Cancer Society, we've been first of all, we've been working with the policymakers. We've been sitting on the table with in the National Cancer Program. We've been pushing the agenda and momentum, the discussion, maintaining the discussion about the importance of the elimination of cervical cancer, and basing all of our discussion based on the WHO and the regional initiative. And that's mainly the backbone for all of our discussion. And in addition to the advocacy level, also we've been working at let's say 2 or 3 different layers. With the community, we've been working on the community awareness about the cervical cancers, the national campaign, the risk reduction for that, also HPV vaccination. And we've been working at the school levels. We've been having agreement with the Minister of Education. And we've been providing awareness to the school students. The focus a lot, mainly on the discussion initially was the cervical cancer and HIV vaccination with the female, and not also all of the student. Also, we targeted the whole ecosystem in the schools, meaning the teachers and the administrative. And when you are looking at the school as an ecosystem, it's really build up the momentum of the awareness in that the system. And collaborating back and forth. So this is system. University also, the university, and especially that majority of the students. I mean, there's a lot of people go to the big Qatar University, so we've been doing agreement with the Qatar University, and awareness session that is pushed and driven by the student themselves, and we've been building on the health students, and even we established clubs in the medical and health students that they carry forward this initiative and cervical cancer awareness. Moving on to the public, and we've been reaching the public in 2 different methodology. One is the corporate at workplace. So all of our partners from the variety of corporates that have been supporting the cause of Qatar Cancer Society, we've been conducting sessions and collaborating with them, even building the capacity of the nurses or the health occupational health advisors in every entity to carry on that message, to amplify the message of cervical cancer awareness, the HPV vaccination. In that perspective, also we've been working, that's kind of summarize the public, and on top of that, the media people, the media teams. It's very essential, not TV, radios, social media, and not only kind of 1 or 2 talks. We've been producing radio and TV ads that go on for a period of the year, and produce those videos with the experts, and people went through the and we had the pleasure to work with Ms. Fathia, Dr. Fathia was in a couple of campaigns, awareness campaign, and using the voices of people that they went through the experience and they understand the importance of the vaccination. So this is the let's say the arm of the community, the arm of the people lived with the disease, or they were able to catch it early and in the pre-cancer stage and benefit from the vaccination. We've been amplifying their voices significantly, and there is nothing more powerful than the power of the story. So that's we've been so their meaningful participation, the journey, we emphasize on it in a variety of media, and we've been kind of looking which best tool to be more cost effective. We've been very vigilant about the sustainability of that. And the last perspective, which is very important, and we've been collaborating with the Primary Health Corporation, private sector, and so on, is working with healthcare professionals on building up the knowledge about the cervical cancer and HPV. And we are now in the next step of having the strategy of improving the communication skills regarding the HPV vaccination with the healthcare professional. I think this is the area in collaboration with the Ministry of Public Health. And regarding collaboration, just last night we had a big public event that has panel discussion for the public and people living with cancer, that with cervical cancer in particular and ovarian cancer. We had MOPH, PRCC, and National Center for Women, Hamad Medical Corporation, all of them sitting on the same table. And also women lived with Dr. Fathia was with us in the panel discussion yesterday in the event. And there was, I wish that you guys were here. You've seen a lot of how actually when we explain everything clearly to the women, they just push forward, and they want all of them. They want, I mean, last night, seriously, if we had the vaccine outside the door, we could have gave vaccine to all of them. They could have took it, all of them. They were that. So this is kind of what we work, and also the same. We work at the level of regional and international initiative. And one of the we are proud to be part of the team that work with FOCP and the Regional Cervical Forum. We've been we've been working with the monitoring and evaluation data, reporting data. So that's a global health strategy. We've been working with you guys, so it's a pleasure, and through the Gulf Federation also. So that's kind of I know it's a long answer, but it's kind of those are the layers that we focus on.
Yeah, actually, this is very comprehensive, and I think definitely to address this issue, we have to be as inclusive as possible and follow comprehensive approaches. So I really appreciate your answer, Dr. Hadi. Now we can, I'm going to ask another question to Dr. Lubna. So Dr. Lubna, as the head of the early detection service for breast and cervical cancer in Morocco, I'm aware that the country has implemented a national early detection program for cervical cancers that focus not only on raising awareness for prevention, but also on early detection. So what steps do you believe can be taken to further address the high hesitancy rate in Morocco?
As you said, Morocco implements implement the cervical cancer program and institutionalized it in 2012. And for women age 30 to 49, and also who was performed in all primary healthcare services. It was free of charge, and despite all the efforts, the most high participation rate we do have is 10% in 2019 before the COVID-19 pandemic, and in 2020, 21, and also 22, we are about 4 or 5% of participation rates, despite all the efforts. In 2022, in September, we launched and we organized a big campaign during 1 month, and despite all the efforts, we do have a lot of hesitancy. In our last DHS, which is the demographic and health survey, we have more than 94% of women who knows about the cervical cancer, the HPV infection, and the benefits of the screening. But despite all this knowledge and this we have a lot of hesitancy. That's why we wish that the switch to HPV testing will be more benefits for our participation rate, and we can have more women. We are also testing the self-sampling as maybe an element to enhance this participation, and also to revise our communication strategy to have maybe more c'est ciblé en français, to have to target the key population, maybe to enhance this participation rates. Over to you, Reem. Thank you.
Thank you, Dr. Lubna, and we hope that this participation rate will increase with time, and definitely we have to take into account building trust between the public and the communicators. So as Dr. Hadi mentioned before, leveraging platforms of influencers and influential players can also maybe enhance this participation rate and make them more confident about taking the vaccine. Now, before we wrap the session, I want to give the floor to each one of you to give maybe a few words to wrap up this very insightful discussion, and hopefully we can continue this discussion even after this forum. Over to you, Dr. Busaino.
Okay, thank you, Reem. My message will be to the women that please don't hesitate, screen yourself, go for screening, and please protect your children by giving them the HPV vaccine as early as possible. Thank you.
Dr. Hadi?
I think this is I will, there is no message after Dr. Buthaina message. I admire Dr. Buthaina. She always put it, the end results. She put all our insight and inspiration in one word. I admire that this gift in Dr. Buthaina. My last is actually, I would say we, from my perspective, we need to improve the communication skills regarding HPV vaccination among healthcare professionals. I think, and not only that, also about the integration. I'm gonna borrow a concept Dr. Lubna mentioned. We need real integration of cervical cancer screening into reproductive health clinics. It's not just, if they ask for it, to give it to them. We need to keep hammer in every time we discuss with them. In every visit for reproductive health, women wellness clinic, have you got your pap smear? Why you are not getting it? This is some things like, do you smoke? That's, those kind of now are standard questions, that kind of thing. And back to you. Thank you so much.
Dr. Lubna, the floor is yours.
Thank you. Donc, my two colleagues said the main key messages that I want to share. Maybe to add, we don't have the right to late too much missed occasion to target and to speak with the women about the issue with the importance of the screening, the prevention, and the case management. We still have a lot to do, and maybe, as you say, together we will succeed and achieve our goals. Thank you.
Thank you all for these powerful key messages and takeaways from this discussion. And I want to thank you once again for your continued commitment to ending cervical cancer as a public health problem.
Thank you.
Thank you. Thank you. Thank you for all.
Thank you so much. Thank you for this great panel.
Thank you all panelists for those insightful discussion covering strategies to tackle cervical cancer in the whole region. And now, Okay, join me in welcoming Dr. Hala Youssef from UNFPA, Dr. Nassim Pourghazian from WHO, and Mr. Majid Muhammad from Friends of Cancer Patients, who will give us reflections of the third Sharjah Cervical Cancer Forum and the way forward. Welcome, and the floor is yours.
Thanks, Michelle. I suppose we're waiting for Dr. Hala and Mr. Majid to join us also.
Well, good morning, everyone. So, am I to start?
Please, Dr. Hala.
Mireille, I am to start?
Yes. Yes,
okay.
Go ahead.
Okay, very good. So, hello, everyone. It's very nice to enjoy the 2 days on discussions for cervical cancer elimination. I was joining online, of course, and listening to all the discussions and the presentations and how are they really tailored to make an effective change on cervical cancer elimination. So I thank everyone for their contribution and the technical oversight for this kind of work. And we're here to discuss our way forward. And from UNFPA's side, we want to build on the progress that has been since the first edition of the 2019 Sharjah Declaration. And as part of the Sharjah Cervical Cancer Forum commitment to the global strategy for elimination of cervical cancer, and also the regional strategy developed by WHO with different partners, we are committed as UNFPA Arab states to advocate for the development and implementation of those strategies and continue on the monitoring efforts using our developed monitoring and evaluation framework to track different countries' progress on cervical cancer elimination. And I think this will be achievable through establishing collaboration with partners, because alone nobody can do everything. So collaboration and partnership is key here, and we'll be depending on better use of evidence-based decision-making, the sharing of countries' experiences and the lessons learned, as well as the best practices to move our targets and achievements forward. I think cooperative capacity building efforts are also needed to expand the cervical cancer control activities, and our acting in solidarity and coordination between governments, national and international organizations will definitely help in that regard. So we can maintain together the momentum on cervical cancer elimination activities as we respond to the Sharjah Declaration commitments, number 3 commitments. And I will highlight the points that were discussed in the webinar and that really resonate on what we're saying. So the role of NGOs was really highlighted in the discussions, and such as the work of Mazaya from Sudan, and suggestions to coordinate the efforts of civil society with the government are really important. We need to invest more in advocacy and embrace the opportunity of having a preventable cancer arena. So everybody should speak this language. Also, we cannot measure what we cannot, or we cannot really know what's happening if we're not measuring and if we don't have data. So investing in data collection, validation, and dissemination is very important, specifically for areas that are not a priority. So vaccine and screening needs to be a priority in different settings. We also need to strengthen partnerships and engage key stakeholders, as I mentioned earlier. The M&E framework and tracking is important. The development and implementation of a communication strategy that embraces the role of social media is important in that region, in our region specifically. And it should include how to address vaccine hesitancy and how to increase women acceptability of the screening process. A strong HPV vaccine introduction communication plan is needed in that regard for social mobilization and attaining the best coverage. We need to invest also in innovation and emerging technologies, specifically that is acceptable to people. And we need to build on what the successes in the UAE after the huge efforts they have done, and having probably an implementation of HPV compulsory vaccination for girls is a suggestion. Enhancing the social media and screening services is also another suggestion. We need to consider women's health from the broader perspective, specifically when discussing cervical cancer programs. Well, these are only highlights of the discussions and what we hope that we can achieve during the coming periods. So thank you so much for all the efforts, preparations, and discussions, and looking forward to better elimination of cancers, of cervical cancer. Thank you so much.
Thank you, Dr. Hala. Micheline, would you like me to proceed?
Yes, please.
Thank you. Thank you for those words, Dr. Hala. I think you put the base very well for me also. Hello, everyone. Greetings. My name is Nassim Pourghazian, and I'm Technical Officer working in the Director of Program Management at WHO Regional Office, where I support the coordination of technical programs. And I think that's very relevant to this agenda, but also this forum. I would like to start by thanking the FOCP and all the organizers for bringing together so many people from different entities, but who all have an interest in supporting this agenda. And I've been working with NCDs for many years now. And of course, multisectoriality is always important in public health, is very important for NCDs. But I think with the cervical cancer agenda, it's really pushed to its edge, considering the richness of the agenda and the 3 streams of work that we want to implement in countries. So that's why I really appreciate this forum and these 3 forums that have been held until now, and this opportunity to bring together different entities. On behalf of my colleagues, Dr. Lamia could not be here today, but I would like to emphasize on exactly this, the importance of joint collaboration, and something that we, at least in our office also, and across the 3 levels of WHO have really aimed to achieve is the collaborations across technical areas of work. And this is something that we also hope to see reflected at the country levels. Since the start of the development of the regional strategy, we have continuously strived towards having all our colleagues that are engaged in either HPV vaccination, reproductive health, NCDs, health system, or any other part that is relevant for the cervical cancer agenda to be engaged and to also use the resources and networks associated with them. And I think that's really key when it comes to the cervical cancer elimination strategy and agenda as a whole. From our side at WHO, now we have this regional strategy, which of course is just a start and a blueprint. What is important is to take that to countries and to make sure that it's adapted to the country settings. We know that we have a very diverse set of countries with different challenges, but to really make sure that we get that rich engagement from the whole of the government and the whole of the society in that respective setting to solve the problems that might be faced in each country. I would also like to stress maybe on the importance of the 3 streams of work. We've talked about the different aspects related to HPV vaccination, screening and treatment and palliative care. And I know from our engagement with countries that sometimes there is this fear of not being able to tackle all. And of course, we need to look where there needs to be a phased approach, but also remember that each of these interventions target different subpopulation, and that's why they are so important in complementing each other. Last but not least, we've already talked about the communication and awareness and how important that is. The use of survivors to inspire people and to really lift taboos and stigma on this subject. I just want to maybe finish on a positive note and say, during just the 5 last years since initiating this flagship initiative at WHO, I feel that we are already communicating and speaking about this matter much more. We can read about it much more. People are speaking more openly about it, and I think when it comes to the communication, we're doing a great job, and we just need to continue that, to have appropriate messaging, but also clear, honest, and target specific messaging that allows us to push this agenda forward. I won't dwell into some of the details. Of course, we have a lot of opportunities across the 3 streams of work. We have 7 Gavi eligible countries in our region and 6 additional middle income countries that can qualify for support for HPV vaccination. This is a great opportunity for our countries to take advantage of. And I think it's important also that as participants in this forum from different countries and different entities, we exchange our experiences and the successes that we have managed to achieve. I think for us, it's important also to bring together countries that have similar contexts and that can learn from each other. We see that in Morocco, they're moving towards HPV testing, which will be a great experience to share with many other of our countries. And hopefully also we can get the support we need from UNITAID and other such entities to push the pricing to make sure that we not only have cost saving in terms of HPV testing and shorter intervals of screening, but also have more affordable tests in itself. I'll stop there. Once again, thanks for the organizers, and I look forward to WHO's further collaboration with all of you as we push this agenda forward for all the women and girls in our region. Over to you.
Thank you very much, Dr. Naseem. And Mr. Majid, the floor is yours.
Thank you so much, Dr. Naseem, Dr. Hala, for your contribution. My name is Majid Mohammed. I am the Advocacy and Scientific Executive at the Friends of Cancer Patient Organization. Of course, it has been a very enlightening 2 days of discussions and informative dialogues. We have representatives from government, representatives, academia, regional and international cancer organizations, and civil societies representatives on today's forum. And in the UAE, cervical cancer actually is the 6th leading female cancer in the UAE. And thanks to our leadership and UAE strategy, we have become the regional leader when it comes to the implementation of HPV vaccine, and we have included within our national immunization program. And following Dr. Buthaina's input today in the discussion, the vaccine has indeed contributed in the decreasing the incidence and the mortality rate in our country. And today, building on the success of the first cervical cancer Sharjah Declaration 3x3 in 2019 and the second Sharjah Declaration from 2021, we are today pleased and honored actually to announce the launch of the Sharjah Declaration 3.0 in partnership with our colleagues from UNFPA Arab States Office. So one of the main recommendations from the second Cervical Cancer Forum in 2021 is to endorse the establishment of a robust monitoring framework for the progress of the HPV vaccine implementation and cervical cancer elimination. And through the monitoring framework report that has been developed by Dr. Nasreen Kamal from the UNFPA ASRA office, the report results can affirm that today we do need to invest in better data collection and analysis and utilization as well to support the evidence-based decision-making. as well as to address the current inequalities of HPV vaccine implementation. We need to keep investing in advocacy and communication plan to get the message across to different multi-sectorial partners and in our member states, and to become our key advocates to address the gaps and to allocate proper resource mobilization to maintain the implementation of the vaccine and to ensure sustainability. At the end, we want to reach a high level of coverage for this vaccine and to save lives of young girls. Now coming to the end of the third Sharjah Regional Cervical Cancer Forum, I can only thank all the esteemed experts and speakers who have contributed in sharing their perspectives and shared experiences and actions needed to minimize the impact of cervical cancer in our regions. Through this forum, we were able to discuss ways to support the Sharjah's agenda of providing innovative solutions and strategies and collaborative and practical elimination plans to be implemented in future years to come. And I really looking forward as FOCP to meeting you all on the fourth Sharjah Cervical Cancer Forum, inshallah, to be physically in the upcoming years. And to invite our regional and international partners to hopefully celebrate our progress when it comes to the establishment of more successful cervical cancer focused programs, and to align our efforts with the WHO cervical cancer elimination strategy with multidisciplinary collaborations, inshallah. Thank you all again, and it's my pleasure to be with you today in this session. Over to you, Ms. Shireen.
Thank you all panelists, and now coming to the end of the third Sharjah Regional Cervical Cancer Forum, we would like to invite Mrs. Aisha Al-Mulla, Director of Friends of Cancer Patients, to give us her closing remarks. Mrs. Aisha is a leader who possesses a strong commitment to creating a positive impact within her community. Her academic achievements demonstrate her attitude for finance and her drive for self-improvement. Mrs. Aisha began her career as Senior Finance Coordinator at Salam Ya Saghir, where she effectively managed projects for Palestine and Syrian refugees and oversaw the department's yearly and monthly budget and expenses. In September 2015, she assumed the position of Head of Programs at the Big Heart Foundation, where she coordinated with existing and potential partners and implemented projects for all the initiatives under the foundation. In July 2022, Mrs. Aisha was promoted to the role of Deputy Director of Friends of Cancer Patients before becoming Director in October 2022. Mrs. Aisha will address her, we will address her recorded video.
Ladies and gentlemen, esteemed guests, I am honored to speak to you all at the closing of the third Cervical Cancer Forum 2023. I want to thank all members of local, regional, and international health authorities, Ministry of Health and Prevention, our co-organizers UNFPA, WHO. Your efforts and contributions to this important event have taken us all forward in our goals to eliminate cervical cancer within our communities and the whole world as well. Over the past few days, we have heard about the devastating impact of cervical cancer on women and girls in the MENA region, and the urgent need for action to prevent and treat this disease. We have also discussed the role of the HPV vaccine in preventing cervical cancer and the importance of building a comprehensive HPV vaccine implementation strategy plan and communication strategy to improve advocacy, social mobilization, and awareness in the region. It is clear that we must accelerate our efforts to stop the death of women and girls from this preventable disease. This requires not only political and financial support, but also a concrete effort to engage with communities and raise awareness about the importance of prevention, screening, and treatment as well. As we come to the close of the third Cervical Cancer Forum, I am proud of the release of the Monitoring Framework on Cervical Cancer Report, which has been piloted on 6 countries across the MENA region and that has contributed through the data gathering and the monitoring results to access the progress of HPV vaccine implementation and cervical cancer elimination. However, we must not become complacent. There is still much more work to be done, and we must continue to advocate for the resources and support necessary to ensure that every woman and girl has access to the prevention needed and treatments they need. This includes not only the HPV vaccine, but also access to screening and treatment services, as well as education and awareness campaigns to empower individuals to take control of their own health. We must also recognize that the fight against cervical cancer is not just a medical issue, but a social and economic one as well. We must work to address the underlying factors that contribute to the impact of cervical cancer on certain populations, including poverty, lack of access to healthcare, and culture and the social barriers. In order to achieve the goal of total elimination of cervical cancer in the MENA region, we must work together across even sectors and disciplines and engage with communities at all levels. It is only through collaboration and determination that we will be able to overcome this devastating disease and ensure a brighter, healthier future for all. In conclusion, let me say that the third Cervical Cancer Forum has been a resounding success, and I am confident that we will continue to make progress in the fight against cervical cancer. So thank you all for your participation and commitment to this cause.
Thank you all panelists of all those insightful strategies to tackle cervical cancer and save countless lives across the region. Coming to the end of the third Sharjah Regional Cervical Cancer Forum, I would like to thank all the participants who participated in this forum, as well as our supportive partners, Ministry of Health and Prevention, Emirates Oncology Society, HRA, Kuwait Cancer Control Center, Mazaya Charity Organization, Qatar Cancer Society, Rufaida Women's Health Organization, and we would like to thank our official sponsor, MSD. Thank you very much, and looking forward to seeing you in the 4th Regional Cervical Cancer Forum. Thank you very much.